I'm Femi OK, and you are in the stream home edition. Welcome to my dining room table. Now, today we are talking about people with disabilities and the impact that the coronavirus is having on them. I have an excellent lineup of guests, so I am going to get them to introduce themselves. Hello, Shantha.
Hi, I'm Shantha. I'm the Director of Disability Rights at Human Rights Watch.
Good to have you in the stream. Hello, Anne.
Oh, hi. I'm a Paralympian and a disability rights and inclusion campaigner and a sports activist also.
All right, looking forward to you bringing your expertise to our conversation. And hello, Dr. Kim.
Hi, I'm Kimberly Jackson. I'm an osteopathic physician and a disability rights advocate and activist with the Colorado Cross Disability Coalition. Preferred pronouns are she and her.
Good to have you, Dr. Kim. So, as always with the stream, we are an interactive conversation. You can be in the conversation as well. Hello, YouTube. Thank you very much for being here. You can comment, you can add questions, you can push back. What are your stories? Please send them to us in our chat. And also, if you're on Twitter, at ajstream is how to get in touch with us. Let me start with a tweet from the United Nations Enable Group. And they say on Twitter, COVID-19 pandemic comes with particular challenges for the most vulnerable, including people with disabilities. Check the WHO tips on how to ensure everyone receives the care they need during the coronavirus pandemic. And then there's a graphic, and it talks about physical barriers to access hygiene facilities, the need to touch things. You have to touch things. Difficulty in enacting social distancing and difficulty accessing information. So the WHO is boiling it down. Not only is the coronavirus difficult for everybody, but particularly if you have disabilities. Dr. Kim, from your perspective, can you give us an example of where someone with disabilities, from your experience, is going to be struggling right now in this pandemic?
Well, for those of us with more severe disabilities, we often need help from care providers who come into our home. Most of us have multiple care providers who may or may not work with other clients. And so something we've been struggling about is here in the U.S., and I understand around the world, there's a shortage of personal protective equipment, both to keep our care assistants safe and to keep us safe as people with disabilities. And so I think that's something we've really been trying to figure out solutions for. I'm sure you've seen in many countries, people have been working on cloth masks to help cover the face and protect the spread of the virus. And we also talked about things like using even trash bags to cover your clothes so that you don't carry the virus around on your clothes, or having a separate set of clothes that you wash as soon as you can and you change when you get to the person's house, and then you're able to wash those clothes there and move to different places. But of course, all of that creates unique challenges as well, because some of those resources aren't available. It's not easy for people with disability to get access to some of those. And then also just coming up with a plan. Well, this is not stuff that's really meant to be doing that. So how protective can we be, and how can we achieve that with what we have and what's available to us?
And I'm looking at a piece that you wrote quite recently. Go ahead, Shantha, and I'll bring in Anne.
Sorry, I was going to jump in.
Yeah. Jump in.
No, I was
going to jump in.
I think you raised a good point, Dr. Kim. I think that's for people who have caregivers who are still coming at home. And then there's, of course, people who, because of the quarantine situation, the caregivers are no longer able to come. And, people who need help for daily things that we all take for granted, eating meals or taking showers, have even more challenges in really doing those basic tasks. And I think that's where the situation is even more complicated for people with disabilities.
And I was saying a little bit earlier that there was a piece that you wrote, particularly as from your perspective as a Paralympian, but I know that your concern is about people with mental disabilities or also mental challenges as well. Can you explain that piece? Why did you write that?
First of all, let me start by saying that disabled people have been excluded from most government's emergency planning. And because of that, I think the marginalization is just sort of like taken a different scale altogether. And that plays a lot on people's mental well-being. Can you imagine being disabled and having to rely on a caregiver, for example, on having to rely on certain facilities in the community that helps you live sort of a normal life, and then suddenly the government says, they announce an emergency lockdown, for example. They announce that you cannot just go to the supermarkets, and then you realize, like what Dr. Kim said, that suddenly you are at risk, even by somebody who's coming to to give you that care or that support. And I sort of just realized that mental well-being is what holds us together, as a person. Since all this began, I've had so many emails and text messages from people with different challenges or different obstacles telling me that their mental health is really struggling. There was one person who suffers from anxiety, and this person told me that, and every time I switch on the news and they talk about statistics of how many people have died, this person is thinking, should I just commit suicide because his anxiety has gone really high? There's another one who sort of like really struggles with the OCD. They keep cleaning and, washing their hands. But when the media is so full of wash your hands, sanitize, and all that, she actually found herself cleaning the walls of her house. And I think you know, we are getting all these good messages going out and telling us how we should stay safe, how we should observe this hygiene and stuff like that. But then we also need to realize that there's a group of people who are struggling more from everything, and that's why I wrote that piece. And I said, how do we learn to control or help our mental health, our mental health or our mental health, well-being at this particular time? It's sort of like learning different things and just sort of like learning to really think of number one, and number one is yourself behind those closed doors. What is happening?
Right.
How are you
And can
accessing support? How are you?
And I just want to just jump in here just a little bit, because YouTube is talking to you as well, talking to our guests as well. Hello, YouTube. Thank you for being part of the show today. Rebel Wills NYC says, yes, the disability erasure. People often talk about the elderly and the vulnerable. So vague, but not always. Disabled and or chronically ill. It's not new, but it's frightening. It almost feels like, Shantha, that the prejudices that are already out there are heightened by this pandemic. What's your experience been, Shantha?
I'd agree. I mean, we've heard a lot about the situation in nursing homes, and it's staggering the number of deaths that are taking place. But one of the most invisible groups, at least from my experience, the work at Human Rights Watch, is people who are living behind these closed doors, these institutions, mental health facilities, where no one really knows what's going on. And these are hundreds of people who are living in many countries in unsanitary conditions, laying on the dirty floor, don't have clothes on or very raggedy clothes, who don't have access to nutritious food. And in some cases, in many countries, we've even found people who are chained because they have mental health conditions. And in these kind of circumstances, you can just imagine if the COVID pandemic reaches these institutions, just what kind of devastation will happen there. And yet they're invisible. And what we hope to do, and along with a lot of our partners, is make sure that we're telling their stories and making sure that the COVID response doesn't exclude them.
Shanta, I really like
And
what
I
you're
just,
saying.
I,
I just feel
And
like
you go
Shanta is
first, and then
talking
Dr.
about.
Kim comes in second.
I just feel like Shanta is really talking about, about Africa, and especially if I may speak of East Africa, because I'm originally from Kenya. Caregivers are unable to keep that social distance, because they have to carry on assisting, persons living with disabilities. But at the same time, they are the breadwinners. They have to go out in the community, go and do the small jobs they do so that they can bring food back, at home. And when you talk about the PPE, personal protection equipment, that is unheard of. It's not in the vocabulary of any person in East Africa at the moment. And that is where my fear is, what is really going to happen when this pandemic hits these developing nations.
Let
And
me just
here in the
bring.
U.S., sorry,
Yes, Dr. Kim.
here in the U.S., in a lot of skilled nursing facilities or nursing homes, we talk about older people that are living in the nursing homes. But again, the invisible population is there are lots of younger people, even with disabilities, that are in nursing homes. Some of my friends grew up as children in nursing homes and only were able to get out with the assistance of a lot of programs that we started to work to establish here in the U.S. And the problem with that is that being an invisible population, they are just as much, if not more so, at risk than the rest of us with disabilities of COVID. As Anne was saying about especially nursing assistants here in the U.S., they often have to work at multiple nursing homes because their pay is significantly lower than a lot of the other people, the staff that work in the nursing homes, and they don't have the personal protective equipment to use to keep them and their patients safe. And I actually just went to a webinar on Friday, and we talked a little bit just about online and how we're all learning to be more online. But this was an online webinar I went to, and they said one of the biggest infection control problems was simply hand washing, and that really nursing assistant staff, they have 8 or 9 patients that they have to see. They may all be trying to get showered at once. And so it's really hard to wash your hands between each patient. And so a lot of these nursing homes have become huge incubators of COVID with very large numbers of deaths because they're unsanitary conditions. They are unsafe conditions. And so I think we've worked a lot so that we don't have the level of abuse that they have in some places. And certainly, I mean, some nursing homes are better than others, but we still have a lot of these problems here. And they're not talked about in terms of disability. They're talked about in terms of older adults.
Yes, let me tell you
Kim,
about
I would take it even further.
Lebrun. Shantha, if I may, I'm just going to bring in another comment here,
Sure.
and I'll come right back to you. Do excuse me. N.A. Lebrun is an author, and on Twitter, she was discussing disability and the coronavirus with us. She says, I'm in a wheelchair, I don't drive, my housemate has severe visual impairment and cannot easily tell if she's keeping social distance. My MP told me to go to a local charity, but food parcels don't cater for dietary needs. And it was such an important conversation that we actually then called her up and asked her to explain a little bit more.
The UK government is neglecting its disabled people with the vulnerable list that it has given to the supermarkets. It's ignoring those of us with mobility issues, who are autistic, and who have other issues that stop us food shopping. It should be expanded to meet the needs of all disabled people within the UK, not just those with susceptibility to the virus. There are those of us who can't get out and who don't have support, who need it.
And what we're finding in this situation is that all of the provisions that are being made for lockdowns all around the world, they're not necessarily thinking about people with disabilities. Shantha, go ahead.
No, exactly. I was going to make a similar point. When we've done work on the situation for refugees in many countries, and we've actually looked at the situation for refugees with disabilities. Now, you can just imagine how difficult it is to do social distancing and keep your hands clean and have hand washing in refugee camps. But when you add a layer that you're a person with a disability, I mean, one of our close partners is an amazing young woman named Eugene Mustafa. She's from Syria, and she traveled all the way from Syria to Germany in her wheelchair a few years ago. And she has been working with us to tell the story of the situation of refugees with disabilities. She told us how when she was a refugee in Greece, she wasn't even able to wash her hands at the tap. And that's in a normal circumstance, let alone now, because the tap was too high for someone in a wheelchair to reach. And then we've heard stories from there and in other conflicts in Africa and the Middle East where people with physical disabilities in particular are literally crawling into the toilets because the toilets are not accessible. And so when you think about the health risks that are associated, now you add COVID on top of that, I mean, it's an impossible situation where in many cases people with disabilities have been overlooked.
Yeah, no, I think Shanta, you are really right. I'll give you an example of what is happening in Kenya. There's increase in violence at the moment, and there's a curfew that has been rolled out in the whole of Kenya. But I think the problem is the police don't know how to enforce curfews on people with disabilities. So they're actually mishandling or really treating these persons with disability in so bad ways. And I'm sort of just wondering whether, like the Human Rights Watch, you are going to be looking at this, because it's terrible. For example, when a woman with disability was found outside, outside her house, selling some stuff, and the police, instead of helping this woman, they took everything that she was selling and poured it all over her. The women are being raped. The women are being, people are stealing from these women. It just really breaks my heart. And I'm sort of wondering, is the world watching? Everybody's talking about COVID-19 and how it's affecting the elderly, but nobody is really talking of how it's affecting the disabled people. You won't believe it that here in the UK, people with disabilities are so afraid of what will happen to them when they go to hospitals, because the rule that has come now, what was rolled out 2 weeks ago, is that if a person with a disability contracts coronavirus and goes to the hospital, the doctor has a choice on whether the able-bodied person who looks healthy and strong should be given priority of getting the specialized treatment, and the disabled person should be ignored.
And if I may,
homes, for example.
And if I may, because I want to illustrate this a little bit with a letter that has been circulated, and it has basically been very frank, and it says that this is a very hard letter to write to you, but it also says people with these conditions are also unlikely to be offered hospital admission, and these are conditions, disabilities. Offered hospital admission should they become unwell, and certainly will not be offered a ventilator bed. So it is basically having a hierarchy of who is worthy of treatment, who is not worthy of treatment. Dr. Kim, it's quite shocking that this hierarchy should come from the medical profession itself. Can you explain to us why that's happening?
Yes, and I would actually say that if you know what physicians can be like and what it can be like to be a physician, it's actually not that shocking. One of the studies that I was looking at, they did a survey of emergency room providers, and 18% said they would be glad to be alive after a spinal cord injury. But when you actually interview spinal cord injury survivors, 92% report a high quality of life. And when I was in medical school, we had an end-of-life class where we were talking about end-of-life options. And the general consensus of many of my classmates, not myself, and this was before I even had the disabilities I'm dealing with now, they would rather be dead than in a wheelchair, or they would rather be dead than have feeding tubes for the rest of their life to help with nutrition. And the irony, too, is that I ended up both in a wheelchair and I have feeding tubes and I need help with my nutrition and using all of that. But what I'm trying to say is just that as providers, many providers feel that disability is the end of your life. Your life is over. There's no good that can come out of it. And so that then gets translated to, well, this person has a disability. They must be miserable. So why should they get care anyway? Because their life's really not that meaningful. And when you talk to people with disabilities, that's not it at all. We're very happy to be alive, and we're very happy to continue to live our lives, even though we have very unique challenges that we have to learn to navigate.
This feels like a really good point to bring in guests. Do excuse me for 1 second, to bring in a very well-known American disability activist called Alice Wong. And Alice Wong feels that a lot of these strategies that have been made and these provisions that have been made during lockdowns and the coronavirus strategies for communities around the world have been done without disabled people because they haven't been thinking about disabled people.
This pandemic highlights systemic inequalities and bigotry around the world, and how some groups are considered less valuable than others, such as Black and brown people, sick, older, and disabled people. One lesson that can be learned is that we are desperately needed as essential experts with power to craft policies and practices that impact us. This is an issue of political representation and self-determination. that it's no longer acceptable for decision makers to casually accept marginalized people as sacrifices in this pandemic.
And that's the key.
And Femi, I
Nothing
would add, they
about us
haven't been
without
talking
us.
to disabled
Shanta.
people. Exactly. I think they haven't been talking with people with disabilities. I think that's the other element of that's missing, is that there needs to be consultation with people with disabilities when it comes to these medical protocols, when it comes to how to support them to live on their own in their own homes. I mean, that's where there needs to be a lot more outreach. And in honor of that principle that you just mentioned, nothing about us without us. And I think when it comes to these triage protocols, sorry, just one sec. I just want to highlight, like Kim, you just mentioned, people judge that your quality, the quality of life of a person with disabilities. I mean, you both are living testament that people with disabilities can have very high quality lives, and that the idea that, in so much of the research that I've done, especially on people with mental health conditions or people with certain disabilities, they have told me again and again that people say to them, you're less than human. They feel less than human. And they feel that people don't see them as equal human beings and that their life is not worthy. And I think we need to listen to people with disabilities and consult them and actually, have more examples of people like you both who are out there advocating that people with disabilities should be treated equally.
So, guess one of the things that we haven't spoken about, and do excuse me 1 second, is about youngsters and kids. And Pradeepan Jiva is a dad of a youngster who is autistic, and he had, until the coronavirus pandemic, he had amazing one-to-one carers and special carers and an amazing school, and now he is trying to do that all by himself.
Because of the shelter-in-place quarantine, my son with special needs autism is no longer receiving the one-on-one therapy that he really needs. And he's not going to sit behind a Zoom screen, a video chat, or a digital chat room. It's just not working for him. So it really feels like we're pressing pause on his mental development to protect the safety of other people. And I just don't understand why the Washington state government says that his therapy isn't an essential service. But as a family, we're doing the best we can. We're trying to make this work. We're making it a makeshift classroom, but we're not professional caregivers, so it's really taking a toll on us.
So what I'm thinking is the disabled communities around the world are incredibly resilient and incredibly adaptable. I want to just go very quickly around you all and give us one thing that is positive about what can be done in this situation. If you have a disability, your loved one has a disability, and you start.
I think if you have a disability, it's sort of just really trying to amplify that voice. Listening to Dr. Kim, it sort of just proves that, when you have a disability, you can still have quality life, and that is what we want. But also, personally, what I'll probably say is raising funds, raising more awareness. I am so happy that, for example, New York Rugby United are going to be working with me, with my foundation, to make sure that we equip as many disabled people as possible with masks and sanitizers and, diapers and, sanitary pads that these people need. So I tell you what, we are resilient and we have to stand together. We are in this together, and we have to really try to bring the government on board.
All right.
I would just add that we need to have information that's available in ways that people with disabilities can get vital information about COVID and how to prevent it. There's easy to read, plain language examples that are out there, but they're few and far between. And we need governments and hospitals to provide more information so people with all types of disabilities can actually find out about COVID and help protect themselves.
Okay. Dr. Kim, bring us home.
I think, too, we can also be amazing resources. Many of us with disabilities, especially more severe disabilities, are used to social isolation. So we know how to stay connected. We know how we can get involved remotely, and we know how to fight boredom of just being stuck at home. And so a lot of people think of us as people who need to be taken care of, but I think we can also be role models and people that can teach a lot about skills that are useful during the pandemic.
Dr. Kim
You're here.
and Shantha, really appreciate your wisdom. One more place to visit, and that takes us to YouTube. And the gamer says, thank you, the gamer. Only if we had spent all of those trillions of dollars we spent on militaries, on improving healthcare and other development, we would be in a much better situation. Wisdom from YouTube comments. When does that ever happen? Thank you so much, everybody. See you next time.